Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you.
Hi class and welcome to Essential Drug class PHS 426 for this week. Last week we looked at topic 3 where we looked at essential drugs, WHO model list, and the different reviews WHO does take before a drug is listed as an essential drug. So today we will be looking at topic 4, essential drug list for primary healthcare in Nigeria. What are those essential drugs that are in the primary healthcare in Nigeria? So at the end of this lesson, we should know the definition of primary healthcare as basics, and then understand the history of essential drug list in Nigeria, and also know the classification of essential drugs in Nigeria, the drugs that are in the list. So what is primary health care? How do we define primary health care? Now, there is a standard definition of primary health care according to Alma Ata Declaration conference or convention that was held in Russia. Alma Ata is in Russia. So this definition stems from that conference, and it's essentially a health care that is based on practical, scientific, sound, and socially acceptable methods. So such primary health care must be practical, it has to be scientific, sound, and socially acceptable methods with the best of technology that is made universally accessible to individuals and families in such community through their full participation. In other words, they must have to participate, and at a cost that the community and the country can afford to maintain at every stage of their development in the spirit of self-determination, or some people will say self-reliance. So those are the definitions or the components of the definition of primary health care. Now, there are so many components of primary health care, but because we're talking about essential drugs, we will narrow it down to the components that affects essential drugs. Now, one of the components of primary health care is that it's of universal coverage because it ensures sufficient supply of medicines and services, thereby removing financial barriers to access and ensuring social health protection, among other components, like I said, of primary health care. But these are the ones that focus on essential drugs: universal coverage, ensuring sufficient supply of medicines and services, removes financial barriers to access, and making sure that there is social health protection of the population. So let's look at the history of essential drug list in Nigeria. It all started in 1988, eventually received legal backing through a decree of 1989 that was promulgated. That decree is called Decree 43. Since then, the essential drug list in Nigeria has undergone several revisions due to stakeholders' inputs and what we call criticisms. It has undergone several revisions at different times and different years. It's also, the decree that promulgated this was also amended in 1992. However, at the moment, work is always in progress at reviewing this essential drug list to reflect the realities of essential drug needs of Nigerians. Remember, essential drugs must satisfy the needs of the population. So from time to time, it's constantly in review. So what are the problems with this drug supply system in Nigeria? What are the problems? Before the enactment of the law and promulgation of the decree and revisions and all that about the essential drug list, we had problems, of course. So what are those problems with essential drug system in Nigeria before this list was in the law, was promulgated to guide the essential drug list? So the problems before this essential drug program was established was especially poor funding of healthcare services. There's inadequate baseline data to enable suitable, what we call suitable proportioning of the little funds available. In other words, resources are scarce, we always say in the health sector, and when resources are scarce, you must prioritize and apportion your funds as may be needed. So there was inadequate baseline data that will enable such apportioning of funds according to where it is needed. Then there was misplaced healthcare priorities. People were misapplying funds and in the healthcare sector and doing all sorts of things that are not needed. There was also an inadequate and inappropriate communication system in the health system. There was poor instruction by prescribers and dispensers to patients. Patients were not having adequate instruction on how their medications should be taken and why they should take such medications. Or even up till now, such things still happen. Some people don't even know the medications they are taking. And then self-medication without prior instruction from health workers. Some people self-medicate. They go over the counter to buy medications and take without health professionals prescribing medications. Then there was also what we call genetic variations in drug response. How people respond to drugs is of individual basis. No human being is ever the same. So some people might react adversely to some medications more than others. So what are the advantages of the essential drug program finally when it was instituted? It actually limited the number of drugs that were deployed by providing what we call concise, accurate, and comprehensive information of all essential drug lists in the National Drug Formulary. It helped in improving the knowledge of prescribers regarding the pharmacological properties of the prescribed drugs, and that also enhanced quality of drugs. It helped in improving drug utilization through better monitoring by healthcare professionals, and then that actually helped in bringing about sound policy, legislation, and essential drug programs that included education of health professionals and patients, especially in the rational use of drugs. That actually helped to reduce polypharmacy, overprescribing, and under-prescription. So how do we classify essential drug list for primary health care? The classification of essential drug list is based on what are those elements of the primary health care. Primary health care is made up of the health centers or the health facilities at the local level, the village dispensaries, the traditional birth attendants, all other health workers that are in this category. All of them are grouped as primary health care. So based on that classification, we have generally placed the essential drug list into category A and category B, or class A, class B. Now, class A, which is the health centers at that level, we have example of a class of drug that is in that category is the anti-allergic medicines. The type of drug in this category is called the epinephrine, the chlorpheniramine maleate, and the promethazine. These are medications that are in this group of anti-allergic drugs, and their formulations are some are in injections, some are in tablets, some are in syrup. Epinephrine is an injectable. chlorpheniramine malate and promethazine also comes in injectable, and they come in tablet and syrup. So let's have an activity. Name anticonvulsants in class A. Anticonvulsants are also classes of drugs that are in that category A that are found at the health centers. So what are those drugs that are in this class? The class of drugs that are in this category, what are those? Anticonvulsants. So the anticonvulsant drugs include the diazepam, paraldehyde, and phenobarbital. These are the drug types that are in this category at the health center level: diazepam, paraldehyde, and phenobarbital. The formulations at which they or preparations at which they are found, diazepam, paraldehyde come as injections, and then we have also diazepam tablets, and then we have phenobarbital tablets. These are the preparations at which, or formulations at which they are found. So we have the class B, the village dispensaries, the traditional bed attendants, and other healthcare workers at that level. They are classified as B. Example of drugs in that category, you have mostly drugs that are called over-the-counter medications, OTC, fall into this category. You have aspirin, you have paracetamol, you have the Pyrentel, which is I think is a warm medicine, and then we have the folic acid. So the category that which they appear, most of them are usually in tablets and syrups. So in summary, with definition of primary health care, we've also understood the history of essential drug list in Nigeria, and then we looked at the classification of essential drug list in Nigeria. In our next lecture, we'll be looking at the concept of drug revolving fund. Drug revolving fund, DRF. Thank you for listening.